We're now going to have a look at assisting a patient to go from sitting on the edge of the bed to lying on the bed. So the patient has just transferred to the bed, making sure that their hips are in a good place so that once they're lying on the bed, the head should be hopefully on the pillow. So it's a very hands-off technique. I'm really prompting the patient to do as much as they can and to be as independent as possible. So from this position, we're sitting on the edge of the bed, so the patient can start the movement by reaching across and putting the elbow down, and at this point I can then again prompt to bring their feet up onto the side and to then push that arm through, push on this arm here to roll back onto the bed. If for whatever reason when the patient starts to bring their feet up they're unable to, what I might do to assist is at this point I might bring the height of the bed up a bit because it's better for my moving and handling. I don't want to risk injuring myself. I can use a towel or a sheet or a slide sheet and wrap it around the patient's legs. And what I'll do is I'll say, ready, steady, lift, and on the lift I will walk your legs up onto the bed. Okay? So from here we've got a ready, steady, lift. I'm walking the feet onto the bed. Then at this point the patient can then use this hand to push and roll back onto the bed. And if we've got the feet in this position and for whatever reason we're not quite in the middle, I can use a slide sheet to just put under the feet. And I can then push the feet into the middle of the bed, straighten out the legs, and then we're flat on the bed.